oversight of Allenbury High School to speak against a bill to legalize physician-assisted suicide nationally for 6 minutes.
So, first of all, we must recognize the previous speaker's personal connection in this issue. Because of his relatives, he has a personal spin in the argument, and he may or may not present facts as such. Moving on, furthermore, we must look at some specific examples, and we must clarify specific things. Murder is illegal. Murder has always been illegal, and murder, hopefully, will always remain illegal. Suicide is illegal. We're not going to change that. The bill isn't debating that. Okay? Suicide will always remain illegal. However, anyway you look at physician-assisted suicide, it's still suicide, right? It's still the killing of yourself. It doesn't matter how you spin it. It really doesn't. Because any way you look at it, it's still killing yourself. Physician-assisted suicide is wrong. Every life is valuable. We need to be able to help people before we kill them. We should help people. We should help people get better. We deny people the possibility of a better life by letting them kill themselves. We destroy the opportunity for them to possibly lead a happy life in the future. We deny people. We deny them the hope of a future. We take that away. Terminally ill cancer patients, while they may be in a lot of pain, there have been incidents, many incidents, in which they've actually recovered. Take Lance Armstrong, for example. A very, very famous case. He had, I think it was 2 months to live, something like that, I'm not entirely sure. But he ended up winning the Tour de France 7 times. 7, correct? And he doesn't have cancer anymore. He was terminally ill. If he would have killed himself, he wouldn't have won the Tour de France. He wouldn't have become such an inspiration to so many patients now. Terminally ill people are never without hope. If we kill them, if we allow them to kill them. So if we allow them to kill themselves, we get rid of their hope. Even when they might not have hope, we must have the hope in them. We must help them get past that time in their life to maybe reach a better time. Please don't allow people to kill themselves. Please don't allow human life to be wasted. Human life is not something to be thrown away. Thank you.
I just want to ask, you said suicide is morally wrong. I just want to ask, under what moral authority are you actually posing that statement? Because last time I checked, most existential writers and philosophers, people say philosophers, will claim that the only real argument
So let me answer your question with another question. Is human life valuable? Is individual human life valuable?
Okay, so I was saying that we're denying them the chance for a better future, but these were things that terminally ill people will die. These are cases that there is like 0.01% chance of any survival. And is it fair to condemn them to a life where they are going to be suffering non-stop and the use of drugs may only addict them to a point where the drugs will no longer even work in their system? Is it fair to condemn them to that fate just to keep them alive for our selfish reasons because we want them here?
We are not keeping them alive for our own selfish reasons. We are keeping them alive in order to give them hope for a better future when they themselves might not have hope at that time.
Yes. You keep saying that we are keeping them alive, we are doing this, and it's a doctor's choice. But who is in charge of your life? Is it the doctor or is it you? Who makes that decision? Do you really think the doctor has a right to tell you? You really know, and it has been said that you're not going to
when citizens are not fit to take care of themselves, it is society's duty to take care of themselves, to take care of them until they're again fit to take care of themselves.
Since as a society we believe in the principle of the right to life, everybody has the right to life. So you think that also could be interpreted as we have the right to control our life, also using our life.
So your statement's a little contradictory. You say that you say that we have the right to life, but I agree with that. But you also say that we have the right to control our life. And what if momentarily, I know this doesn't entirely apply to the situation, but what if momentarily we decide to end that life? And the next moment we don't. And what if we had already ended our life? We would have ended the opportunity for our life to get better. And that is the root of the problem here.
Speaker's time elapsed. This bar mixed up with main speakers, the chair now recognizes Ken Kawahara to give a main subsequent speech. Sorry. Well, actually, sorry, I messed up, but that technically is what it is. Was the main speaker now a subsequent?
So it's something. Okay, so it seems like everyone sticks on the terminal cancer issue, so I will stick with it too. Chemo actually is, especially if the cancer has metastasized, which means that it's moved to other organs in the body. So if you have metastasized bone cancer, it means that the cancer has moved to your liver or your heart or your lungs or somewhere else. Chemo, what it does is it essentially kills pretty much all cells that it can. Yes, it does do a very good job at killing the cancer cells, but it also kills other cells, such as the ones that line the GI tract. And that's why there's the entire issue about medical marijuana, is because most people undergoing chemo are so sick because they don't have this protective lining that if they try to put anything into their body in terms of food, they'll throw up because they simply cannot handle it. So why would we say, oh, you can't kill yourself, you just have to continue to undergo this treatment, which at max is only going to give you maybe 6, 7 months to live. Why should we say that you have to suffer this unbearable pain and this humiliation of knowing that you are going to die, knowing that you have absolutely nothing you can do to stop it? Why should we make them suffer this for 6 months more than they have to if they choose that they don't want to? I have a relative who recently died of colon cancer. No one saw it coming. It was very bad cancer and he knew he had it. He was undergoing chemo, and a week or two before he died, he was supposed to get married, and that day he was so sick and in so much pain that he couldn't go through with the service. And it was heartbreaking because he truly loved this woman. She had been with him since the very beginning of his cancer story, which went back 6 years. Also, as Faraz said, this isn't a rushed process. It's not just, hey, you have cancer, do you want me to kill you now? They would probably go through psychological therapy to make sure that they're not just making this rush decision. Also, there's what's called a DNR order, or do not resuscitate order. It says that if something should happen and a patient in a hospital flatlines, if they've signed this order, you're not supposed to try to resuscitate them in any way. You're merely supposed to let them die. And someone just killed themselves anyway, either by stabbing themselves or any other means. And by the way, yes, Lance Armstrong did survive, but he's half the man he used to be.
No.
experienced losing a loved one. Well, so have I. I lost my cousin to leukemia. She was 16 years old, and she wasn't ready to go, and it was very heartbreaking for me. I was very young, and it was very traumatic. But I am personally against, what is it called? Physician-assisted suicide, sorry. It's my tough for me. One, because it can encourage people to give up a little too soon. And I know that you really don't understand what that means, but if you think about it, you've been diagnosed with terminal, some terminal illness. And what do you think? Like, what do you do? Do you let go? That's going to be the initial reaction. Is not, are we going to fight and struggle, or are we going to let go? But because there's this option that of physician-assisted suicide, it could definitely encourage people to let go before the fight is really done. Also, there would be a huge religious uproar. And I know that, we separation of church and state, but if you think about it, all of the different branches of Christianity who do not believe in suicide in any way would flip out. I'm just so you know, I mean, any physician-assisted suicide is unacceptable. Unacceptable, it's not tolerated. And not that I put much stock into what different religions say, but I just know that it would definitely be extremely detrimental to the United States if all the religious groups of the United States were to throw a huge hissy fit. Healthcare. We've had, in the past, we had a huge difficulty with the healthcare corporations not treating people for illnesses that are curable. So now that we have these terminally ill patients that have the option of physician-assisted suicide, now aren't the healthcare corporations going to encourage the people that are terminally ill or ill with a very painful disease to die or to take physician-assisted suicide simply because they do not want to pay the extra money to take care of them every day? I'm 100% sure that it's going to cost more money to put a cancer patient through chemo than it is to kill them, to assist them in suicide. So that is not okay. One thing that we're not taking into mind is how the doctors feel. Now, I know that these patients are suffering, and they're obviously in a lot of pain, but these doctors are going to have to go in and help these terminally ill or very heartbroken and people that are in immense pain die. Now, I don't know about you, but I wouldn't want someone, a doctor, to be working on me right after he killed someone. Like, that is not an emotionally stable situation. It goes against the Hippocratic Oath, just to do no harm, and for those reasons, I believe that we should vote con on this bill.